It is now 17 minutes after the hour. There's a new study in the Journal of the American Medical Association this week that really points up the benefits of staying fit. And so we thought this would be a good week to have a clinic on sports medicine. Today's subject is tennis. Playing tennis, a terrific way to stay fit, but what's great for your heart may be murder on your elbow. And so this morning we're focusing on tennis elbow, something you know a lot about, in our final segment of Good Morning America's Guide to Sports Medicine. With us now, orthopedic surgeon Dr. Robert Nirschl, a pioneer in the treatment of tennis elbow, and it's good to have you with us.
Oh, it's our pleasure.
I've seen you quoted as saying that tennis elbow is a heart attack of the tendon. Tell me what that means.
Yes, overuse of the tendon breaks it down and the blood vessels get squeezed out, and the degeneration of the tendon is sort of like a heart attack, if you will.
It's not, there's not blood flowing through that area.
That's correct. It doesn't get its normal nutrition.
Now, when you're talking about tendon, because when I think of the elbow, I think of bone. So where's the tendon that we're talking about?
Well, actually, the tendon is the wrist tendon, and that attaches to the bone at the elbow. So it basically, if I can demonstrate, is the tendon that lifts your wrist, and sometimes that lifts your fingers. Right. And then that muscle unit attaches to the bone here. So it's actually the wrist muscle tendon unit which causes the problem.
Where does the pain manifest?
The pain is manifest right here. So if I can get my thumb on your tendon, it's right in there, and then also over the bone to some degree. But it's often called a epicondylitis or a bone problem, but it's wrong. It basically is a tendon problem.
Can you build up that tendon to be less apt to get tennis elbow?
Yes, the folks who get into trouble basically are often deconditioned. So if you take up a sport to get in shape, it's the wrong way to go. You should really get in shape to play tennis, if you will.
So what do you do to build up that tendon?
It needs to have rehabilitative exercise. The goals of rehabilitation, of course, then to improve weakness.
Right. Exercise like what? Give me a model exercise.
Specific things, weights to your wrist and your forearm. Also, tennis elbow very often involves the shoulders, so that the exercise program should involve the upper back and the shoulder as well as the forearm muscle groups.
Are there particular people who are vulnerable?
Yes, there are some who by heredity I think have less durability in their tendons. It's like having 60,000-mile tires for the durable people and only 30,000-mile tires for the less durable people.
Is there, if you have it, do you have to quit tennis? I mean, do you tell people, oh, too bad, you're out of the game?
Not necessarily the treatment. The biological goals of the treatment, of course, are to get new blood supply and get new strength, endurance, and flexibility. And if you accomplish that with rehabilitation, then you can certainly go back and play, and the huge majority of folks can do that.
One of the things that strikes me is that tennis equipment has changed so much in the past, 25 years or so. But even these new rackets are incredible. If you watch Wimbledon now, it's serve, return, bang, volley and gone. I mean, the rackets really are amazing now. Does that contribute in any way? The new racket's better for tennis elbow? We've got a wooden racket here. Yes. We've got various incarnations here of rackets.
Yes. Well, the old rackets, basically you had to have nice, smooth, good strokes, and you could do all right. The new rackets are much lighter, and they impart more energy, so you can cheat with your strokes, and you can play a little bit better. But if you cheat too badly with your stroke, it can still create an overload in your tendon and create a lot of difficulty.
Really, what you're saying is, no matter which racket you use, you've got to have a good stroke in order to avoid this.
It's a good idea to have very good technique.
All right. Well, show me about technique. Bring me over here and tell me what you do wrong, or what's the average player do wrong?
Well, usually the average player makes the mistake of punching the ball and pushing out like this, and so that overloads all of these forearm muscle groups. Golfers the same thing, by the way. But good stroke basically is to use your body weight and also to flow with your shoulders, so you're flowing this way.
So on the back end, you want a good arm movement, and you also want transference of weight back foot to front foot.
Exactly. Anybody who punches this way is very vulnerable.
I noticed the first thing you did was demonstrate a backhand. Is the backhand the more vulnerable stroke, or the stroke that can give you more problems in developing tennis elbow?
It's more vulnerable on the outside. The forehand is more vulnerable on the inside, so that the tennis elbow can also occur on the inside. So the forehand, if you're late with your forehand stroke and swing this way, that creates a problem.
Come on back. We were talking earlier in the week about golfers and bad backs. And obviously, a lot of the famous golfers, Fred Couples, for instance, comes to mind, who has a bad back. Do any of the terrific tennis players have tennis elbow? Is it a problem for the pros as well as the amateurs?
Yes. Even if they have good stroke mechanics, just the repetitive overuse, thousands and thousands of times hitting the ball, will wear down those tissues.
One other thing, how about grip size? Somebody said you've developed a a way of measuring grip size that's important. Is that, since the wrist is so close to the grip?
Yes, basically we've measured from the palm out to the ring finger, and that gives a very good approximation as to the appropriate grip size.
Base of palm.
Well, from this crease here in the middle of the palm, the crease closest to the wrist in the palm, and measure out to the tip of the ring finger, and that gives a good working length of the hand.
And that's key for helping tennis
And that's
elbows
key
on.
for choosing the correct grip size. That's correct.
Dr. Nirschl, thanks very much.
Well, it's our pleasure.
Good to have you with us. It is 23 after. We'll take a break for local news, and then Good Morning America continues.